Hi, my name is Jocelyn Torres, and my project will be over schizophrenia versus dissociative identity disorder. Due to these two being mixed up constantly, stigmatized and stereotyped. When it comes to psychological disorders, many people tend to confuse one with the other. Such disorders tend to have similar symptoms. Therefore, people, usually not knowing any better, tend to mash all the disorders into the ones that are most commonly heard. According to WebMD, a mental disorder, also called a mental illness, psychological disorder, a psychiatric disorder, is a mental or behavioral pattern that causes either suffering or poor ability to function in ordinary life. Many disorders are described. Conditions are excluded, include social norms. Signs and symptoms depend on the specific disorder. This is just a little psychological joke. I don't know who you are, but if you keep confusing schizophrenia with DID, I will find you and cut you. Again, this is stigmatizing and stereotyping. Many people tend to confuse schizophrenia and dissociative identity disorder, previously known as multiple personality disorder. This is due to stereotypes most likely seen in movies. Let's define and differentiate the two terms. According to Mayo Clinic, schizophrenia is a severe brain disorder in which people interpret reality abnormally. Schizophrenia may result in some combinations of hallucinations, delusions, and extremely disordered thinking and behavior. Contrary to popular belief, schizophrenia isn't a split personality or multiple personality. The word schizophrenia does mean split mind, but it refers to a disruption of the usual balance of emotions and thinking, not a split personality. Some symptoms include delusions, disorganized speech, disorganized or catatonic behavior, negative symptoms, and many suicidal thoughts. According to Mayo Clinic, in men, schizophrenia symptoms typically start in early to mid-20s. In women, symptoms typically begin in late 20s. It's uncommon for children to be diagnosed with schizophrenia and rare for those older than 45. Thanks to Hollywood, people with schizophrenia are seen as dangerous and out-of-control people. This is not true. When I was 13, I had a neighbor who was diagnosed with schiz, and he was one of the smartest and sweetest guys I have met to this day. There's usually something that triggers the symptoms, but people with schizophrenia can live a regular and happy life. Schizophrenia requires lifelong treatment, even when symptoms are subsided. Treatment with medications and psychosocial therapy can help manage the condition. Now let's move on to dissociative identity disorder. According to psychologytoday.com, dissociative identity disorder is a severe condition in which two or more distinct identities or personality states are present in, and alternately take control of, an individual. The person also experiences memory loss that is too extensive to be explained by ordinary forgetfulness. According to Mayo Clinic, signs and symptoms of dissociative identity disorder include memory loss, mental health problems, a sense of being detached from yourself, a perception of people and things around you as distorted and unreal, which includes paranoia, a blurred sense of identity, significant stress or problems in your relationships, work, or other important areas of your life. People with DID can be dangerous to others if one of the personalities developed are more violent. However, the main persona may not remember causing such harm. While the causes of dissociative identity disorder are still vague, research indicates that's likely a psychological response to interpersonal and environmental stresses, particularly during early childhood years when emotional neglect or abuse may interfere with personality development. This is usually before age 9. Dissociation may also happen when there has been insistent neglect or emotional abuse, even when there has been no overt physical or sexual abuse. Findings show that in families where parents are frightening and unpredictable, the children may become dissociative to be able to handle that. Psychotherapy is the primary treatment for dissociative disorders. This form of therapy, also known as talk therapy, counseling, or psychosocial therapy, involves talking about your disorder and related issues with a mental health provider. Schizophrenia versus dissociative identity disorder. People seem to most often confuse someone who is suffering from schizophrenia with someone who has dissociative identity disorder, categorizing both as being crazy. Again, stigma and stereotyping. Let's compare and contrast. While both are chronic, serious mental health concerns, the differences between these two disorders are apparent to those who are educated in the matter. People with schizophrenia hear or see things that aren't there and believe things that aren't true, often tied into a complex, irrational belief system. They do not have multiple identities or personalities. People with DID do not have delusional beliefs outside of their multiple personality or identities. The only voices they hear or talk to are these identities. Now that we know a little bit more about both schizophrenia and dissociative identity disorder, let's try our best to stop stigmatization and, I'm sorry I messed up a little bit there, and stereotyping. Stigma and stereotyping are what make people think that people with mental disorders are crazy, which is not true. Crazy should not be allowed around people with mental disorders. Thank you.